Each year, the first Friday of February is National Wear Red Day, a day when the National Heart, Lung, and Blood Institute calls attention to the #1 killer of women, heart disease. The centerpiece of the Heart Truth campaign is the red dress, which was introduced as the national symbol for women and heart disease awareness in 2002 by the National Institutes of Health. Every year, about 715,000 Americans have a heart attack. About 600,000 people die from heart disease in the United States. That's 1 out of every 4 deaths. We spoke with the specialist at Florida Hospital Waterman Heart Center about the importance of knowing your numbers, your family history, and recognizing the warning signs of heart disease.
Heart disease is the #1 cause of death in the United States across the board. It's prevalent in both populations, and unfortunately females sometimes is misdiagnosed. That's what the month of February, the American Heart Association call it Dress Red Month, on like we have in October, the breast cancer awareness, the pink month. And that is because women sometimes historically, they say, well, like I said, heart disease is a disease of a male. And that's not the case. We know now that the leading cause of death in females, combined that all the cancers together, is heart disease. So it's not that it's more prevalent, it's that it's probably in the past was misdiagnosed, and now we know that it's there, so we look into it. But again, the patient usually needs to go to the doctor and say, I'm having these problems, I'm having shortness of breath, I'm not feeling well, I'm getting extra tired, I'm having chest pressures or heaviness. A lot of people think it's pain, not necessarily pain. Heart disease, blocked arteries can present as a heaviness sensation on the chest, a discomfort. Usually happen with exertion, and it can happen also at rest, but most commonly on exertion. Now, diabetic patients may have no symptoms when this happens.
Trying to understand, how do we identify patients who are at risk for blocked arteries and for heart disease. There are 2 groups of patients that we look at. One are patients that are symptomatic, and then one that are patients that are asymptomatic. Women tend to have atypical presentation. They have fatigue, sometimes sadness or depression. Sometimes they don't have any symptoms until the day they have a major heart attack. From the time of symptoms in men, in an age-matched population versus women, women tend to present about 2 to 3 years later. So they've been holding on to these symptoms for a lot longer, not ever thinking, that it was heart disease. And pretty much anyone after the age of 40 needs to be into some type of what I would call maintenance program. So they need to see their regular primary care doctor, even if they have no symptoms at all, to start to do what we call risk stratification. If you've had a lot of family members, have early manifestations of cardiac disease, if you're overweight and you have high blood pressure and so forth, how we would take care of those patients is different than the 40-year-old who's at a perfect body weight, has no medical history, and runs 20 miles a week. And you can't change the facts. You can't change what your weight is and your age, your blood pressure, at least not at that moment. And that's where I think the greatest opportunity is for helping improve the care of the patients in our community.
According to the CDC, the 5 major symptoms of a heart attack are pain or discomfort in the jaw, neck, or back, feeling weak, lightheaded, or faint, chest pain or discomfort in the arms or shoulder, and shortness of breath. And in honor of Heart Month, Florida Hospital Waterman is hosting a heart-to-heart health and wellness expo featuring over 50 clinical and educational resources, as well as a free health screening on Thursday the 13th in the main entrance atrium from 8 to 11 a.m. You'll find more information about the Waterman Heart Center as well as the link to the latest heart health statistics when you click the Heart Month story link on our homepage at yourhometownhealth.com.